Dr. Stringer, thank you so much for joining us here on Health Connection. We're glad to welcome you. Our topic is chest pain and the emergency room, and should you or should you not go? And so let's start talking about heart attack, which is what stands at the root of chest pain when it's a problem. Heart attack symptoms we know are different from person to person. We know they're different between men and women, but what's common with respect to heart attack that we should all look for?
Sure. As most people know, chest pain is the big symptom that we're always worried about. And people always think of heart attacks as being, oh gosh, my chest hurts and you fall down and you're dead. And that does happen occasionally, and it can happen quite rapidly. But chest pain, again, is the most common complaint. Occasionally you will hear from people that they say it's not pain, it's pressure, or it's tightness, or it's fullness. And so the chest pain itself can have a variety of different aspects to it or sensations to it. Along with chest pain, a lot of people are going to experience shortness of breath. They may experience nausea. They may experience sweating or cold sweats. Those are very common. Occasionally, they will also experience pain that comes from their chest and may radiate to one arm, both arms, their neck, their jaw, even to their back.
Okay. Many times, chest pain can be something other than a heart attack.
Sure.
What could those other things be?
There's a lot of different things that people experience as chest pain. Heart attacks, reflux, okay, heartburn. Sometimes people who have a clot in their lung may experience chest pain. A lot of people will experience chest pain just with musculoskeletal issues, such as I lifted too much, I've strained my pecs, I have arthritis in my chest wall. That sort of thing can cause frequent chest pain as well.
Can an ordinary person tell the difference between chest pain that's something else and chest pain that's a heart attack?
So quite possibly, yes. A lot of times the musculoskeletal type chest pain may be easy to locate just by palpation. So you may be able to touch a particular spot and say, okay, that is what hurts. And that usually helps us to discern between what is actually cardiac pain and what is musculoskeletal pain. The other types of pains are more difficult to distinguish between, say, for example, a blood clot in your lung and a heart attack, because a lot of the inner organs don't have the same innervations as does the skin and the muscle and the bone. Typically, the skin and the muscle and the bone will be experienced as a sharp type of pain, whereas cardiac pain or organ pain is usually a more dull sensation. That's why a lot of people say that they feel pressure or tightness, something that's a little nondescript, as opposed to my muscle's sore, it hurts right here.
Okay, well, let's get to this. If you or someone you know is experiencing chest pain, how do you know when it's time to call 911 and head for the ER?
Oh, great question. So when someone is experiencing chest pain and it's not lasting for just a few minutes, it's lasting for a while, or it's getting progressively more severe, or they feel like they're in distress or look like they're in distress, especially if they're having a difficult time breathing, that's when you need to think about getting to the emergency room. And you need to call 911. You should never drive yourself, because if you pass out while you're driving, you're going to hurt yourself or somebody else.
Okay. Does a family history of heart disease make it more likely that a person's chest pain is related to heart attack?
Certainly. We ask patients a lot of different questions concerning past medical history and family history because it definitely has an impact on their risk for heart disease. We know that people who have first-degree relatives, meaning brothers, sisters, mother, father, or sons and daughters, who have had a history of heart attack are going to be at an increased risk of heart attack themselves.
Okay. Well, let's stay in that vein where
Sure.
we're talking about risk. For someone who's already had a heart attack, do they have an increased chance of experiencing chest pain that will signal a second heart attack?
So their chance of experiencing chest pain may be the same as any other person. The problem is that a person who's had a heart attack, their chest pain is more likely to be from another heart issue. That's the worrisome thing. That's why we take it very serious when someone says, I've had a heart attack before and it felt just like this.
Okay. If you're with someone who thinks they're having a heart attack, what should you do immediately, and why is immediately so important?
So when we have a heart attack, the heart muscle is not getting enough oxygen. The longer that it goes without oxygen, the more likely you are to have that part of the heart die. And so what we say is time is muscle, or time is myocardium, meaning the heart muscle itself. So time is of the priority. We need to get that person who thinks they're having a heart attack to an emergency room or even to an EMS truck as soon as possible. That way we can do an EKG and see if they're having a very large heart attack. Those large heart attacks are important to get to a cath lab very quickly so that we can open up that artery and save as much muscle as we can.
Amplifying on that, somebody you think's having a heart attack right then and there before you dial 911. Anything to do immediately?
Sure. I mean, you need to look at them. If they collapse, then we may need to initiate CPR. If you have aspirin available, then taking 325 milligrams of aspirin or 4 baby aspirins may help save that person's heart tissue.
Very well. And why is that? What does aspirin do?
So aspirin is it's an antiplatelet agent. Platelets help stop blood flow, right? Just like they do with any kind of cut. When we have a clot that is broken loose that is in one of the coronary arteries, there are platelets that start to come in around that clot and form a bigger clot to help stop the blood from moving through. If we can stop those platelets from working, which is what aspirin does, then we may help to preserve some blood flow through that artery.
Okay. What if you're near someone that you believe is having a heart attack and you don't know CPR?
Oh, that's a tough one. Lots of people are very scared about CPR. It's not very difficult, and the American Heart Association has now recommended that we do hands-only approach for people who don't know what they're doing or who may be afraid of doing mouth-to-mouth resuscitation. So it's quite easy. You would take the palm of one hand, place it in the center of the person's chest over their breastbone.
Okay.
Then you're going to put your other hand on top. You interlace the fingers and try to push down with the heel of your palm hard. You're going to push down hard and deep and fast, and you're going to keep doing it. And you're going to keep doing it until EMS arrives.
And it's really that straightforward?
It's very straightforward. If you lock your elbows, it's a lot easier. You'll get a good push, and you'll have a lot better success with pumping blood through that heart that's not working.
Very well. Doctor, very interesting. Thank you very much for your time.
Yes, sir. My pleasure.